These contracts provided to CBC News confirm that some of the top people at Health P.E.I. don't actually work for the Health Authority. They're employed by private employment agencies, and that comes at a big cost, as much as $44,000 a month for Health P.E.I.'s interim chief medical officer.
So when you break that down on a month-over-month basis, it's basically the same amount.
Health P.E.I.'s CEO, Melanie Fraser, says she had no choice but to bring in people through private employment agencies. That's because, in her words, Health P.E.I. had to terminate or end the contracts for a number of senior managers, following a damning Auditor General's report last October. That report showed 8 top executives were given salaries or raises without proper approval.
Because they weren't approved positions, we canceled those contracts. And in the interim, because we didn't have positions to hire into, we sought the support of interim executives to help us keep our important health initiatives moving.
But it is costing more. For example, Health P.E.I. is paying a private firm, Odgers Berndsen, for its interim chief medical officer. That's one of the most expensive contracts at about $44,000 a month, or about $525,000 a year. The Health Authority is also paying for accommodations and travel. Health P.E.I. says with salary and benefits, it could fill that post directly for about $450,000, a savings of about $75,000.
I was shocked and disappointed to see what is in these documents.
Opposition parties are calling for answers.
It's big money, and the minister can no longer say that the previous CEO was acting frivolously with the tax dollar, because here we're seeing 5 times the amount of overpayment to these positions.
Means that a large portion of the money that should have gone towards their care is going to outside agencies across the country to make sure that they have a leadership team in place. And I don't think that's right for any of the 37,000 people on the patient registry that don't have a family doctor.
Charlottetown is here.
The Auditor General is still looking into what Fraser describes as additional payroll irregularities that were detected beyond those already flagged by the Auditor General. The AG hopes to report on that this fall. Health P.E.I. is now developing a new senior leadership team, one that will be hired directly through the Health Authority. Those details will be released next week. That's 2 months behind schedule. Fraser had promised to have the new leadership structure in place by April 1st. Wayne Thibodeau, CBC News, Charlottetown.